Ultrasound, also known as ultrasonography, is a medical imaging technique that uses high-frequency sound waves to create images of the internal structures of the body. It is a non-invasive and safe diagnostic tool that has a wide range of applications in various medical fields, including obstetrics, cardiology, gastroenterology, and more. Ultrasound images are generated by sending and receiving sound waves, which bounce off tissues and organs, creating a visual representation of their internal structures. Here's a detailed overview of how ultrasound works, its applications, advantages, and limitations. How ultrasound works. Transducer. The primary tool used in ultrasound is a transducer, which is a handheld device that emits and receives sound waves. The transducer contains piezoelectric crystals that convert electrical signals into sound waves and vice versa. Sound waves. The transducer emits high-frequency sound waves, ultrasound waves, into the body. These waves have frequencies above the range of human hearing, typically between 2 to 18 MHz (MHz). Propagation and reflection. The sound waves travel through the body and encounter different tissues and organs. When they encounter a boundary between two different tissues, such as the boundary between muscle and bone, some of the sound waves are reflected back to the transducer. Echoes. The reflected sound waves, known as echoes, are detected by the transducer. The time it takes for the echoes to return provides information about the distance between the transducer and the tissue boundary. Image formation. The echoes are processed by a computer, which creates a two-dimensional, 2D, or three-dimensional, 3D image based on the timing and intensity of the echoes. Brightness and darkness in the image correspond to the density and composition of the tissues. Movement of structures, such as blood flow, can also be visualized using a technique called Doppler ultrasound. Applications of ultrasound. Obstetrics and gynecology. Ultrasound is widely used to monitor fetal development during pregnancy, assess the health of the uterus and ovaries, and detect potential issues. Cardiology. Ultrasound helps visualize the heart's structure and function, including the chambers, valves, and blood flow patterns. It is used to diagnose conditions like heart valve disorders, cardiomyopathies, and congenital heart defects. Abdominal imaging. Ultrasound is used to examine abdominal organs such as the liver, kidneys, gallbladder, and pancreas. It can detect conditions like gallstones, tumors, and cysts. Musculoskeletal imaging. Ultrasound can visualize muscles, tendons, ligaments, and joints, aiding in the diagnosis of conditions like tendinitis, ligament tears, and joint inflammation. Vascular imaging. Doppler ultrasound can assess blood flow and detect issues like blood clots, narrowing of blood vessels, stenosis, and aneurysms. Guidance for procedures. Ultrasound is used to guide minimally invasive procedures like biopsies, drainages, and injections, ensuring accuracy and reducing risks. Advantages of ultrasound. Non-invasive and safe. Ultrasound does not involve ionizing radiation, making it safe for patients, including pregnant women and children. Real-time imaging. Ultrasound provides immediate imaging, allowing for dynamic observations. Portable and versatile. Ultrasound machines come in various sizes and can be used at the bedside or in different clinical settings. Cost-effective. Ultrasound is generally more affordable than other imaging modalities like MRI or CT scans. Limitations of ultrasound. Limited penetration. Ultrasound may have difficulty penetrating bone or air-filled structures, limiting its use in certain areas. Operator dependent. The quality of ultrasound. Images can vary based on the operator's skill and experience. Limited resolution. Ultrasound images may have lower resolution compared to other imaging techniques like MRI or CT scans. Image interpretation. Complex anatomy or subtle abnormalities might be harder to visualize and interpret using ultrasound alone. In conclusion, ultrasound is a valuable diagnostic tool that uses sound waves to create images of the body's internal structures. Its non-invasiveness, real-time imaging capabilities, and versatility make it an essential component of modern medical practice.